Good morning, good afternoon, good evening. I am Dr. Unati. I'm the host of Dr. M Health Corner Talk Show. Hello, hello. It's a Saturday. It is 11 a.m. MST, 13 hours EST, 7 p.m. CAT or South African time. Hi, everyone. Let me know if you can hear me. Again, I just wanted to uh, basically share with our LinkedIn family. I'm unable to pull up your comments today. As you can see on the screen, it's Q&A. So bring it on. You know, today we're gonna do it with freestyle method. Bring it on. Just ask anything you wanna know medically. Be it a medical question, it's a mental health question. There is no stupid question on this page. There is no stupid question. Again, hello. You guys tell me where you tuning from and please let me know if you can hear me. Again, welcome. If you are new on this page, thank you for joining us. We come here every Saturday just for 30 minutes, 45 minutes if the conversation is going well. Sometimes it goes over an hour. I don't usually stop my guests because, I'm learning along the way and you are learning along the way. Thanks for joining me. So we come here every Saturday. We come for just this 45 minutes period. We learn, we share our thoughts, everything, right? So basically, I am doing this from home. I actually do it once a week. And of course, my daughter now wants me to help her with something. So you're going to bear with me. Thanks for joining again. It's so nice to do it at home because what we are here, it's un thank you, sis. It's basically it's live, right? As you can see, my baby just came, needed help. So this is the beauty of my show. We are so authentic here. There's no stupid question. Let me know what you want to ask. I'm gonna be pulling up your comments here. Hello, Mawawa. Someone is calling is in Pretoria. Thank you for joining, Buti. So yeah, today we're just having a freestyle show. Ask any question. If you don't, I'm going to actually probably discuss something many of you in the last 2 weeks actually have been asked this question so much. I'm gonna wait for you guys to ask this question. If not, I'm going to start sharing what many of you have asked me in the last week or two, right? We were doing a series here on mental health. In the last 6 weeks, I believe 6 weeks ago, we had a young man here in South Africa, very successful, doing really well for himself, committed suicide. So it shocked us. I live in Canada. I was shocked too. So we started doing some learning, some digging, what could have led to that action, right? So you guys have not stopped asking about what is exactly that he was struggling with. I don't know him personally, but I know of how he presented because of the work I do. My background, I'm a family physician. My special interest is mental health, but of course, as a family doctor, we basically look at everything. We basically diagnose, we basically treat, we prevent. So I'm also a big advocate for disease prevention, for chronic disease prevention. So, like I said, throw any question to me, I'll be able to answer you. And of course, I know that many of you have asked to see me. I'm unable to see any of you guys because I practice in Canada medical legally. I cannot give um, the diagnostics of basically what people present with. This page is more educational, okay? We are more educational. Always advise people to go speak to their doctors after you have heard something here. Yeah. So basically, Mawawa has a question. I'm going to pull it up and read it up for everyone. My son just got a diagnosis of for ADHD and started on rotate. I think you are meaning Ritalin. There's a pill called Ritalin, 10 milligrams long acting. Funny this from raising him for 9 years since birth. I saw my struggles in him, born on the late 70s. Okay. Thank you for sharing your story, Mama, and sharing about your son. So basically, ADHD, for people to understand it, or maybe let me leave it on here. ADHD is attention deficit, right? Disorder. It's attention hyperactivity disorder. What it is, it's a brain disorder, right? It's a mental health condition where it's actually defined in two types. There's inattentive, and then there's also a hyperactivity, right? There's hyperactive and inattentive, right? Sometimes it's mixed. Your child or yourself, Mama is saying he also notices that his son behaves like him in the 70s. Truly, back in the 70s, in America, in Canada, where I'm at, in South Africa, many people actually were missed in terms of being diagnosed. So many things, so many layers. People, parents did not know anything about that behavior, more especially for boys. Boys were missed more because we have naturally we have this tendency of thinking like boys are hyperactive, boys are more active than girls, so the diagnosis gets delayed. So this diagnosis, it is genetic. It seems like Mawawa had similar symptoms like his son. How it presents, probably he will agree with me. Like I said, there is inattention or there is hyperactivity. You notice that your child, compared to other peers his age, around 6 7, that's usually the time the symptoms are evident, but sometimes we diagnose it around 9 or 11, because parents are still not sure if is it because he's a boy or he's just being a hyperactive child. And also as doctors, we say, you know what, let's wait a bit till your child starts school, and then teachers are the greatest resource for us because they can see, they observe your child, they are sitting there for 8 hours with your child, they can see how your child focuses. So the biggest thing with the hyperactive type, Mawawa, usually the child is hyper a little bit. They climbing chairs, they are fearless, and it's great to be fearless, but they tend to have these high accident behaviors. They climb trees. They don't necessarily think. They usually just do things. They are very impulsive. They could climb even bridges. If they are adults, actually, they are more prone to accidents. They're more prone to have fines like tickets, traffic tickets, because they are always speeding. There's that hyperactivity. If they are sitting, they are fidgeting. They cannot sit still. The teachers, they notice that your child is always, he or she doesn't wait for his turn. If there's a question asked in class, which is great, a child is okay to be active in class, but they don't wait their turn. There's that impulsivity, so there's usually those symptoms. And then the inattentive one, usually you notice that you are speaking to your child, he or she's somewhere. He or she's she's in class, but somewhere in Cape Town. They are absent-minded. You could be talking to your child, you could leave list of things your child needs to do before you come back from work. He or she forgets. They are inattentive. Their brains are wired that way. And I want to emphasize this: ADHD has nothing to do with being stupid. A lot of times we get resistance from parents when there's a diagnosis of ADHD. Parents start believing that, oh, then did I give birth to a stupid child? Did I give birth to a disabled child? No, no, no. We are all wired differently. And actually, one of people that are very smart I know of, including my colleagues, are very creative. People with ADHD or ADD, we tend to use these interchangeably. They're very smart. They're very creative. They create things. They have ideas. So it's always important for parents to understand this diagnosis. And of course, Mama was said he has medication, the Ritalin. I'm gonna write it down here. Ritalin is one of the medications we use. Uh, it's a psychostimulant which helps a child or an adult to slow down those symptoms. Okay, as much as it's called psychostimulant, but it helps, basically it helps that brain to have limits. It helps that child to also have those impulse control, because you want your child to thrive, you want your child to succeed. I said these kids are very smart. So if your child is not listening in class, is hyperactive, is disruptive, most likely, you know what, the performance or the grades will be low, right? Because he's not paying attention. And actually, there's kids that do well, up to even university, and they notice that, what, when I think back, I behaved this way since I was in primary school. You know, you notice that in your adulthood, you change jobs, one job to another. You easily get bored. You want to be here, you want to be there. You never settled. And actually, it affects even marriages or relationships. You are very impulsive. You go to a store, you go online. We see this a lot, even in stay at home moms. They notice that on top of busy with home, like the stuff they doing at home, they go online, they start shopping online. There's no impulse control, and it affects relationships with spouses. We've seen also divorces because of this. The impulse control, they lack that. All right. So usually it needs insight. It needs insight also on the parent and also the child, because this can also affect a child's self-esteem, because sometimes other kids will isolate your child. Sometimes even teachers, they're not as patient. Some schools are not fortunate to have school psychologists to help your child, or maybe even teachers assistants to help your child have that control. So that's why it's important. The diagnosis is important, and also doing something about it. So there are medications. We don't know really exactly why people have this wiring in their brains. So many studies have come out, but honestly, we don't necessarily know. But we do know that there is a genetic component. If a father or a mother or an uncle or a grandmother had, one of your kids could have this. We do know that, right? There's been also some association of trauma. When you were pregnant, maybe also trauma to me is maybe you abused, drugs when you were pregnant, or your parent abused drugs when they were pregnant. We do see that there is some correlation, or things like lead exposure. People who live in old homes, there's been some association, but we don't have the concrete reason why people have this wiring. And people with ADHD can also have other conditions like anxiety, because you are anxious. I hope I'm not going to behave in that way I did yesterday. I hope I'm not going to be impulsive in class. It can bring anxiety. And it could also cause depression. It can isolate you because you are self-conscious now, right? And sometimes if parents don't understand the diagnosis, they can be hard on the child, the expectations. So we always advise parents to have good education. Counseling is very important to understand your child, right? And also be open to teachers, be transparent to teachers, because sometimes these medications, there's many other pills we use. There's concertas, there's like Mawa mentioned, Ritalin, there's Vyvanse, there's many types of medications. Some pills, your child could need another dose during lunchtime. So the transparency to talk to the teachers who are teaching your kids is very important, so that your teacher meets you halfway. Because at the end of the day, teachers want your kids to succeed and thrive and be like other kids, right? So it is manageable, but what the one thing you need to watch is diet. They can be appetite suppressants. So it's important to watch your child. How is he eating? How is she eating? Making sure that you have those balanced diets, right? It's a whole lot, but I just wanted to summarize it. It is manageable, but watch for other symptoms, the anxiety, and also things like mindfulness, mindfulness meditation, you know, um, counseling, psychotherapy, involve psychotherapists, involve psychologists in this, right? Watch your child. If he is withdrawing, does he enjoy school like he used to, or does she enjoy school like he used to or she used to? Because they can be bullying in this, and also your child could also be a bully, or your child could be bullied. So watch that. How is he interested? So you want to be very curious. In general, we have to be curious at how our kids are doing at school. But kids with ADHD, they also have a high rate of dropping out from school, because school can be boring to them, right? If we don't get the medication and the help they need, school can be boring. they find themselves that they are underachievers because they are not focusing. They are not grasping the concepts because they were not focusing a lot of times, right? And it has nothing to do with what is it, intelligence. It has something to do with how their brains are wired. So accept their diagnosis. If your child is diagnosed, accept their diagnosis. Seek the help, understand it, learn about it, teach your other children, teach your other children, teach the child himself or herself so that or she understands himself, right? Um, Yes, Mama, like I said, it is genetic, meaning that most likely you have the same because you are saying that you think back, in the times you were born in the 70s. Like I said, truly no one really diagnosed this back in the day. So just know that adults are treated too, and you start seeing progress also in your work. People when they have this medication, even your child, you notice that, wow, my child, I thought he was a 50s grade. Immediately he or she's medicated, goes up to 80s, 70s, 90s. It's not always the case. It depends also, of course, your child's potential. But a lot of times the grades go up, the teachers are happy, they share it with you that your child is more attentive, your child is enjoying school. So there's so much we can do for this, right? So understanding of the diagnosis is fundamental when it comes to ADHD. And remember this, it is not a mental retardation. It is not a mental disorder that makes someone be less intelligent. I mentioned I have many friends with ADHD. I have many colleagues that have ADHD, creative, best creators. They are doing great because they're taking their medications. All right. Um, Yes, we also, Mamawa is mentioning that they also seeing an occupational therapist, a speech therapist, seeing is like, absolutely. Thank you so much for doing that. You'll see how your son will thrive because the key thing is also accepting and also seeing the needs your child needs and also meeting them. And many, Mama, you are one of the few people I know that who has gone that extensive because some parents don't even have resources. You know, I said it. I think back, kids that I went with in primary school, now that I remember their behaviors, some had ADHD, but no one knew about it. Where I come from South Africa, no one in my primary school, we didn't have any education psychologists. So there's many kids that get missed. So parents like Mawawa who have the resources, kudos to you. And when you see your child thriving, it's because of the resources that are in place and supportive parents, basically. And not to say parents that don't have these resources are not supportive, but I always say to parents, always seek help. In South Africa, specifically where I come from, medical care is free. It might take long to get in to see that psychologist or the social worker or that doctor, but resources are there, right? Let's help our kids to thrive because help is there, it's out there, right? So, yes. So, yeah, basically, thank you so much, Elizabeth. Thanks for joining us. Let me know where you are joining from. While we are still talking about ADHD, I actually want to emphasize this. Depression is quite common in kids, and uh, parents tend to miss depression in children. Children who are depressed, their presentation might be slightly different from adults. How they present, they might present like being uncooperative. You could think that your child is disrespecting you. You could think your child is isolating. And of course, depression tends to isolate people. So watch your child's behavior. Watch who he hangs out with or she hangs out with. Watch the new the way your child dresses up, right? Some kids cut themselves on the arms and they like wearing the long sleeves. Even in summertime, they would cut their thighs, they would cut their forearms. So be attentive. Be a parent that pays attention to that. Why is your child isolating? Why is your child suddenly losing weight or not eating or sleeping a lot more, right? Not interested to go play out with his friends or her friends. So those are the signs. And if it's an ongoing thing for 2 weeks and longer, those are the signs of depression. So you want to go see your doctor. To be honest, we see kids depressed as young as 3 years old, but we tend to miss that, right? There's so many things that could depress kids: separation of parents, or divorce of parents, or fighting parents, violence in the families, drug abuse, chaos, basically any trauma that could actually cause these kids be depressed, definitely it would make changes in their behavior. All right. So we need to be careful as adults that are placed in these children's lives. We need to be careful how we are showing up to them, right? And seek help. Seek help. I know that coming from Black community, we are very spiritual people. We love our religions. A lot of times people, they go to their churches, they go, which is fine, but just remember, you can never take a broken leg to a dentist, right? You can never take a broken leg to a dentist. So each person can go up this far. Your pastor can pray for your child, but he is not a doctor, he is not a psychologist. So we need to do what we need to do, right? Don't delay diagnosis, don't delay treatment, because this is manageable. Make your child access things that would help him or her so that he or she can thrive. As I'm saying, many of my patients are coming out now in adulthood, because when you're an adult, there's more responsibilities. You have a job, you have kids, you have a partner, you are married, more responsibilities. People start noticing that, my wife or my husband is saying I tend to be too impulsive. Even in discussions, you are the one who always cause that chaos in your relationship, in terms of you are very argumentative, you are never wrong, and also the impulse. There's also usually, we see people coming in, mostly adults, there's usually that conflict or on finances, because you have that impulsive behavior. You don't do things planned with your partner, and then that conflicts, or that causes so much what is it, friction between you and your partner. So adults, we treat them too, and they do well on medication, right? Thank you so much, Olotando. I'm from Ebisho. Konle is my neighbor. Thank you. So yes, again, counseling. As we are going through the pandemic, guys, it has showed all of us that we are all human. We are feeling. We have emotions. So much is happening. People lost jobs. There's broken families. There's broken relationships. So speak up. Speak up. It breaks my heart when we see people even get to a place of committing suicide. You must be in a very dark place to commit suicide. So there is help out there. There's hotlines in each country. There are free hotlines. Pick up that phone and speak to someone. Have that trustworthy friend or a parent. Speak up. No one is immune to pain. Remember that. No one is immune to pain. We're starting to see more numbers of men that are killing themselves, because we have created a culture where patriarchy taught men to be these strong, stoic humans or beings. And now men do not speak up when they need help. So you need to speak up. There's help out there. There's medications for depression. There is counseling. Some people, we treat them for 6 months or longer. It depends on the severity. Speak to someone. COVID-19 made us to sit with ourselves, and we are thinking of the things that happened to us in the past, in our childhood. People are triggered. So these are things that are coming up to the surface for us to address them. I always say seeds of pain, they are never buried. They are sitting there. They are waiting for those triggers, right? And those triggers, unfortunately, they show up in our parenting. They show up in our workspace. They show up in our spouses, in our relationships, in our friendships. So this is the time we are invited. We are invited. This COVID period invited us to sit with ourselves and address the issues we've been sitting on top of for the last 30 years, for the last 40 years. I'm starting to see my patients sharing stories they've never shared with anyone. People in their 40s, they are sharing stories that they were molested, they were raped, things happened to them when they were 6, you know. So these traumas stay right in your subconscious, and then they keep coming out when you get triggers, right? When we get triggered, everyone gets triggered. Everyone here, something happened to him or her, right? It's not necessarily sexual trauma. It could be physical violence. It could be anything you could have witnessed. Fire, like there's so many things that cause trauma to people, and each person responds differently. You could raise three children under the same roof, and all of them, they would respond to you differently, and the outcomes would be different, and you would be using the same parenting skills in all of them. It takes me to another topic, that we need to understand and appreciate each child's personality, temperament, and nurture that, right? Yes. So if there's no other questions, yes, Dr. Jerry, I agree. Speaking is the best medicine. Thank you. Thank you, Doc. Because really, we come from a culture where we have we have actually failed boy children and men later on, because we shush them when they feel. As young kids, we shush them. We don't want them to feel. And then now we wonder why men commit suicide more than women. We say on the studies, women are more depressed, but men are killing themselves more than women. So there's a discord right there. So what we need to redesign societies now, so that we can let men, or give it space, we create space, safe space for men to feel, and boy children to feel. This society and this world will be a better place. All right. If there is no other question, I'm going to close, but I just want to mention this: there's help out there. Seek help. It's free. Pick up that phone. Each country has hotlines. They are free. Speak to your doctors, speak to your nurses, right? Don't stay too long in that corner speaking to. I know that this is gonna sound complex. I know some people, they even go to traditional healers. And you know what? I respect people's choices and also traditions and rituals, but we need to deal with things at hand, right? Depression, there's usually a source. It could be a medical condition. It could be a medical condition that caused that. Could be heart failure you're not aware of. It could be diabetes you're not aware of. It could be a thyroid disease you're never aware of. So last week we talked about the importance of screening. You know, Now we have younger people that are struggling with cancer. That could depress you. So depression has so many conditions, so many causes. So screening is fundamental. It's very important. Nowadays people are living longer because of screening, right? Dr. Jerry is saying, Doc, how do you help someone who feels inadequate? Oh, Dr. Jerry, that is a multi-layered question. How do you help someone who feels inadequate? This is a whole weekend workshop. First of all, there's usually a reason why a person feels inadequate. And I always say, you probably do this in your work, in your institute. Usually, our belief system, our beliefs, as young as 3 years old, by the way, as young as 3 years old, up to probably 5, this is the time our self esteem, or our sense of being, our sense of who we are is built. So that time, that's why a lot of psychologists, a lot of neurologists, or a lot of neuroscientists tell us the first 6 years of life of a child is very important. So whatever downloads you put into that child's brain, that's going to be the template of what they will run with into life, basically. So what we tell our kids at that age, right? And it doesn't matter, you could be telling your child probably even at 10 or 11, whatever you deposit, the words we use to our kids, the words that were used to you will determine how you feel about yourself. Many people are successful outwardly. We think that they are doing great. They are CEOs of companies, but they don't have self belief. They don't think they are adequate. They don't believe in themselves, because there's a charter in their mind that tells them that you are not good enough. Someone said these words maybe when they were 5. Maybe it was a coach, it was a teacher, it was any adult that was in that child's life that said a harmful word or did something harmful to that child. And then you grow up with those words and as that chatter in your head that you're not good enough. So that's very important that we teach our kids or even us adults in their lives to tap into affirmations. What do you believe about yourself? Do you believe what is said about you? What do you tell yourself when you are in front of the mirror? I always say this to moms. I see. What do you say about yourself in front of your 5-year-old daughter? Do you criticize your body? Do you criticize how you look? Because that is what is deposited to that child and how she will view life, right? So it's a whole lot of things, but inadequacy, feelings of inadequacy, they come from trauma. Either it happened even in the workplace. You could grow up knowing who you are, and it happens. All of us, we do feel some vulnerability at some point in our lives when we are vibrating low. It depends on where that person caught you. Maybe you were vibrating low, you had maybe loss of a job or probably loss of a family member. You were just in your deepest dark place, and then you are not feeling yourself. All of us have been there where we don't trust ourselves. There's a lot of times, even successful people, that have not trusted their potential. The imposter syndrome. It depends where you were. Where were you vibrating? What was happening in your life at that time? You would feel inadequate, right? You wouldn't trust your skills. You wouldn't trust your how you would perform. Even we could even applaud you and say, hey, you gave the most beautiful speech, and you would not believe it, right? So it depends where you are vibrating, and it depends on your circumstances. So that's why it's important to watch ourselves when we have burnout. You know, who do we hang out with? What things we consume? What are we watching? What are our circles? Who do we hang out with? Those are the many things that influence us, and we don't realize it until you notice your patterns. The way you speak about yourself or about other people. So it's a whole lot, Dr. Jerry. Actually, I would like to engage you on that one, and please share your thoughts on what I said. And yeah, if there's no other question, I'm going to close this by saying all of us have a potential. All of us have um, stories that God wants us to deliver into this world. And don't ever leave with untold stories. Each one of us, if we could realize this, that each one of us is gifted differently. Each one of us, I was watching this morning a podcast where this woman is saying, let us be aligned with our higher powers. If we are aligned with who we are, who we were meant to be, we would not compete with other people. We would not be envious and end up being jealous of other people's success stories, because as we are aligned with our purpose, now things fall into place. You realize that there is no race here. You are running your own race. You are not competing with anyone. You are doing you, and what is meant for you will not pass you, right? Dr. Jerry, you are saying something here. The triggering thing is absolutely devastating. Imagine someone being triggered by events that happened before you even met them. Oh my gosh, that one is powerful. Yes, we are invited, most especially during this COVID time. I don't know about your work, Dr. Jerry. I have seen people sharing about things that happened to them when they were kids, when they were 5, the stories that happened or things that were done to them. Because this time we were given a moment of silence and also a pause where we are invited to be with ourselves. So there's so many triggers. Now we are invited to unpack those stories, because they will continue triggering us. We're going to show up that way. You could say something to me at work, and then it's not even totally, it's unrelated to what you are saying, but it could remind me of what happened to me. And then I'm triggered, and then I overreact. And then before we know it, our conversation goes south. So we are triggered constantly. So we need to be mindful. We are taught, or we are invited to be mindful of our thoughts, of our behaviors, of our stories, of our past. Unaddressed issues, they will always flare up, in the stories that we are reminded. You know, We are seeing people who are reminded of even the sense of smell, something that happened to you 20 years ago. You are reminded of it when someone maybe is wearing the same cologne or perfume that reminds you of the person who traumatized you 20 or 30 years ago. Our brain is powerful. You know, our sensory centers, our olfactory centers, they are always functioning. So truly, we are constantly triggered, dog. We are constantly triggered, right? Thank you so much for watching. I hope to see you again next week. I'm going to bring a guest here. We want to talk about different topics. We come here and talk about everything concerning our socialization, our academic world. I bring all sorts of speakers here who come to share their knowledge. They come and teach us because I think we are in a world where now we could influence in our little, basements and influence the world by the things we share in this space. So we are invited to share these things. Your grandparents, your parents might not be able to hear what I'm saying, but share with them, share with them because we live in a very small world now because of technology, because of social media. So, and again, I just want to remind you, pay attention to what you consume by watching, by listening, and also watch the circles, the first five. I'm going to leave you with this. Watch who are the five people you hang out with, how influential they are to your life and your choices and your words you use. I'm going to leave you with that. Thank you so much for watching this. And again, Mawawa, thank you for sharing your story. And I hope you also go for your own assessment and get the help you need. ADHD and ADD, we treat, we manage, people thrive, they do well. And also, actually, now that I have you, Dr. Jerry, you are in a corporate space. This is something I always challenge corporate space. People, they tend to lose their jobs or they are fired in the jobs they are doing because there are no EAP programs in the workspace. There is no employee assistance programs because these are the things that could actually assist employees to thrive and be a better place. So each employer, each corporation needs to provide this for the employees because ADHD, it is a manageable condition, but we do see people hopping from one job to the other because they were missed even in their workplace, because workplace, there should be occupational health to help them. All right. Thank you so much, Olotando, for watching. I hope to see you guys next week, same time, same place. Enjoy your weekend. God bless.